we're going to start with just a little bit about FPWA for those of you who may be new members or not members yet. A little bit about us as an organization. So FPWA stands for Federation of Protestant Welfare Agencies, and we are an anti-poverty policy and advocacy organization with a membership network of over 170 human services and faith-based organizations. We promote the social and economic well-being of individuals and communities by advocating for just public policies and strengthening human services organizations. So really, we want to see that every New Yorker is, not only surviving, but thriving economically and socially. And so for the program team specifically, and for today, we're really focusing on the strengthening human services organizations, so nonprofits and faith-based organizations. And the way that we're doing that is this last bullet here. So FPWA supports nonprofit and faith-based organizations by building their capacity to use a trauma-informed and people-centered approach to service delivery, organizational effectiveness, and civic engagement. So today we're really going to be zeroing in on sort of the trauma-informed piece, especially with an eye towards service delivery, which will be its whole own session in a couple of weeks, which you'll hear us reference a few times. And I know that's sort of this focus on trauma-informed care, trauma responsiveness, a trauma-informed approach may be new to some folks. And we wanted to take a moment on this next slide to sort of summarize why we're taking this approach and why we have this focus. So first is, nonprofit and faith-based organizations play an integral role in supporting the needs of individuals and communities. We know that they've been called on in the past, and especially in the last couple of years, especially filling the gaps where government may not be able to support folks. And that's a very difficult job. And we also know that those needs, the individuals and communities that are coming to nonprofits, those needs that they have may be stemming from generational, interpersonal, systemic, and/or community trauma. So for example, they may be coming to you because of food insecurity or maybe housing instability. They may be coming to you for domestic violence services. And all of those things are sort of rooted in trauma or toxic stress. And so in order for us to help support you in addressing those root causes and those manifestations of trauma, we're offering this core set of trainings and resources that are focused on trauma-informed practices. And finally, the ultimate goal here, or the hope, is that we believe that taking a trauma-informed approach will result in an effective and impactful human services sector, best positioned to serve their communities and interrupt the cycle of trauma and poverty. So that's a little bit about us and what we're doing and why we're doing it. We're now going to launch 2 polling questions. I know you can see it on the slide. You can't vote yet. I'll launch in just a moment so you can vote. We want to get a sense of who is on the call. So the first poll that will pop up momentarily asks you to choose which best represents. I know a lot of you do a lot of these things, but choose the one that sort of best describes your area of focus. So let me launch that poll, and you should be able to click on it from your screen. And see a few people doing it, so great. It does appear to be working. I'll give you guys just a couple more seconds. About half of you have voted. Okay, I've got just about everybody. The majority of folks have voted, so I'm gonna end the poll and see if I can share the results with you. There we go. You see it, Laurelise? Okay. So we have a pretty good mix. It looks like children's services and youth development is sort of the largest one, followed by other community support and programs. I think maybe more sort of general community support I'll take. I'm gonna think that's what that means. But a good mix of folks. So welcome to everyone, and we promise the content here is applicable to all of these areas and to any role that you have at your organization. But it's helpful to know who's on the call. Okay. So next is we just want to get a sense of where are you in your understanding of toxic stress and trauma? So I'm going to launch that poll and let folks vote on that one. And they're all anonymous, obviously, so no judgment. I just want to know where you are. Okay. We have 5 more seconds for the last 10 to 14 of you to vote that I can see. Okay, excellent. So I'll share that. So again, it's sort of scattered, but definitely seems like the bulk of folks are in developing. I have some knowledge of the subject. We have a few advanced and a few beginner, which is excellent. And again, certainly the information that we're sharing is applicable to everyone, and it's just good for us to know sort of many of you fall in that middle category. So we'll speed up or slow down where necessary for that. All right, thank you for that. So with that, we'll launch now into what are we talking about today? So today's session is in 3 sections. The first being the definition and prevalence of trauma. So what is trauma? What are we talking about? The second section will be the impact of trauma on a person's brain, body, and behavior. And the reason that this piece is so important is that in any kind of direct service or human services work, can be really challenging, and it is hard not to take things personally when someone may react in a negative way or a challenging way. And understanding trauma and what's going on isn't necessarily going to make it easier, but it does give you a sense of why something may be happening and helping you sort of identify your own triggers and own coping skills to change your approach and your mindset towards those actions. And then finally, we'll end on actually a very short section, which is the importance of trauma-informed approach within the human services sector. And it's not short because it's not important. It actually is incredibly important, but we, on the 29th, September 29th, will have an entire hour dedicated to strategies and actions and practices that fall within that. So we'll just sort of introduce it today almost as a teaser, and then talk about it in much more detail in a couple of weeks. Okay, so let's get started with the definition and prevalence of trauma. So as we start, we want to talk about stress versus trauma and where trauma falls on the scale of stressors. So as we see on the slide here, we all experience stress. But for some, our experiences go beyond everyday stress and cross the line into toxic stress and even trauma. So starting briefly at the top there with positive stress. So what we mean by positive stress is that it's some kind of occurrence that causes a brief increase in heart rate, mild elevations in the stress hormone level. Could certainly be something like first day of school, giving a presentation, giving a toast at a wedding or a meeting, whatever it might be. Things that make you might feel a little nervous, but then pretty quickly your body goes back to a resting state. And that actually experiencing positive stress is a really important part of normal and healthy development. We need to have those experiences to then know how to handle them and bring our bodies back down to a resting state. Tolerable stress, as the next level here, is categorized as serious but temporary stress response. And the thing here that makes something tolerable is that it's buffered by supportive relationships. So for children especially, or young people, that supportive relationship is typically from an adult. For already adults, it could be a peer, a colleague, a family member, a friend. And some things that generally tend to fall into those categories could be something like the loss of a loved one, a natural disaster, maybe a fire in your home. Those types of experiences are often experienced as tolerable stress if you have someone or people, a group, a community that can help you through it, that can support you. If you don't, or if the experience is more severe, that's when we're moving into toxic stress. And here we're talking about a prolonged activation of the stress response system and the absence of positive relationships. And so this is where we may see things like emotional abuse or physical abuse, chronic substance abuse, especially at the hand of a caregiver, if we're talking about children and youth, which I know a lot of you said you work in that area, exposure to violence, the accumulated burdens of family or community violence and poverty. And so when we're talking about trauma, it most often falls in that toxic stress zone, and sometimes even when in the tolerable stress zone, if there's an absence of a supportive figure there. So trauma encompasses feelings of helplessness and terror. It's really the frequency and duration of these feelings that can have severe and long-lasting impact. So again, this may be obvious to many of you, but the same event may happen to two different people, and one person experiences it as tolerable and can sort of move past it fairly quickly, where another person, because of various circumstances, may experience it as toxic stress and or traumatic. We're going to play a clip of a video now. We actually have three video clips, all from the same video. We've just cut it down during today. And it's from Professor Bessel van der Kolk, who is a psychiatrist in the area of trauma, and especially what trauma can do to one's body. He's the author of The Body Keeps Score. And we thought this video was helpful because he just reiterates a lot of the points that we're making. So we'll start here with about a 3-minute clip of stress versus trauma.
The most important thing to know is that there's a difference between trauma and stress. As I like to say to people, life sucks a good amount of the time. We all have jobs and situations that are really unpleasant. But the moment that situation is over, it's over. The problem with trauma is that when it's over, your body continues to relive it. My name is Bessel van der Kolk. I'm a psychiatrist, neuroscientist, and author of the book, The Body Keeps Score. People usually think about the military when they talk about trauma, but at least 1 out of 8 kids in America witness physical violence between their parents. A larger number of kids get beaten very hard by their own caregivers. A very large number of people in general, but women in particular, have sexual experiences that were clearly unwanted and that left them confused and enraged. So, unlike what we first thought, trauma is actually extremely common. There's a lot of debate of what a trauma is to this day. But basically, trauma is something that happens to you that makes you so upset that it overwhelms you. There is nothing you can do to stave off the inevitable. You basically collapse in a state of confusion, maybe rage, because you are unable to function in the face of this particular threat. But the trauma is not the event that happens, the trauma is how you respond to it. One of the largest mitigating factors against getting traumatized is who is there for you at that particular time. When, as a kid, you get bitten by a dog, it's really very scary and very nasty. But if your parents pick you up and say, "Oh, I see that you're really in bad shape, let me help you," that dog bite doesn't become a big issue because the foundation of your safety has not been destroyed. We are profoundly interdependent people, and as long as our relationships are intact, by and large, we're pretty good with trauma. It's a subjective experience, and what may be traumatic for you may not be traumatic for me, depending on our personality and our prior experiences.
Okay, so we'll revisit Dr. van der Kolk a few times throughout this session, but again, some of the things that he was reiterating of experiences are sort of processed differently. Some may be traumatic for one person and not another, and it's really your situation, your support system that can, make a difference in how you are experiencing it. And I would include support system as these nonprofits and faith-based organizations that are here today and the important role that you all play in that. Oops, sorry, no.
The most important thing.
Not going to watch it again. Okay, there we go. So let me go back one slide. There we go. So this is where I want it to be. So just to put it in writing for those of you who are more visual, the definition of trauma, and this is from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So we're going to move now from the definition of trauma to talking more about the prevalence of trauma. And so in any discussion about trauma, you're very likely to hear about the ACEs study. ACE stands for Adverse Childhood Experience. And the ACEs study was originally done in 1995, and it was a partnership between the CDC and Kaiser Permanente. And what it was that during routine health exams, 17,000 people agreed, Kaiser patients, I should say, agreed to fill out a survey about childhood experiences in 3 categories: household dysfunction, abuse, and neglect. And then that data was looked at along with current health status and behaviors. So I think it was 9 or 10 questions in the original study, again, within 3 categories. And the way that they defined it at the time, household dysfunction was exposure to substance abuse, exposure to mental illness, domestic violence, incarcerated parent, or divorce or parental abandonment. Abuse was defined as physical, emotional, or sexual abuse, and neglect was defined as physical or emotional neglect. And 2 of the sort of primary findings that came out of that 95 study were, one, that they found that 25% of folks had experienced at least one ACE by the age of 4. And also that about 2/3 or a little over 2/3 of folks in adulthood had experienced an adverse childhood experience at some point. And another sort of statistics that I always feel is important to give in this conversation is when we're talking about 25% of 4-year-olds having experienced an adverse childhood experience. Those of the 17,000 folks, about 70 to 80% of them surveyed were white and had some secondary education. They also found that you don't just outgrow trauma, right? It doesn't just go away when you're 18 and you've aged out of the foster care system, or you turn 21 and you're seen as an adult, whatever that may be. It can certainly carry through and have negative effects into your adulthood. And so at any age, whether it's children, adolescents, or adults, using a trauma-informed approach and understanding what is going on, what has happened, can really have positive effects that can help to ameliorate some of those negative experiences from the past, or are currently happening, I should say. This is just another visual here to sort of illustrate what's going on. It's called the ACE pyramid. And it's looking at sort of what happens to an individual from birth to death. And so you can see there in the third step are the adverse childhood experiences that we talked about, and sort of what can happen as someone goes through adulthood if it's unmitigated, if someone isn't intervening to help. But what I want to spend a little bit of time now on are actually the first 2 rungs there, the general or generational embodiment and historical trauma, as well as social conditions and local context. So we're going to watch another part of the interview with Dr. Van de Kolk, and then we'll talk a little bit more about what this means in our context in New York City, especially.
The other thing that is terribly important is the impact of poverty, or the impact of racism, or the impact of unemployment. There's other societies that are much more trauma savvy than we are, where there is not an enormous amount of income inequality. Healthcare is universal, childcare is universal. A culture like that really looks at what are the antecedents for certain forms of pathology. So the big issue is a political issue. How do we rearrange our society to really know about trauma, so that people who grow up under extreme adverse conditions can become full-fledged members of society. The sense of community and people being there for each other is a critical part of surviving and thriving.
Okay. I'm gonna move
The
us
other
to
thing
next
that
slide. There we go. Yeah, well, so we'll talk definitely more about generational trauma and historical trauma and systems on this slide and throughout. I think it's such an integral part of the work that we all do. So in this slide, it's in the graphic here, sort of an illustration of what the video was talking about and what we're talking about here. And it's helpful to think about, in general, the first thing that kind of presents when we're talking about trauma or adverse childhood experiences are those branches and leaves that you see there. So mental illness, incarceration, homelessness, domestic violence, substance abuse, things like that. But we also really need to understand and appreciate and work into how we operate adverse community environments. So the generational trauma, the systemic trauma, racism, xenophobia, homophobia, certainly unequal access to quality healthcare, housing, and education, employment discrimination and wage gaps, involvement with public systems such as criminal justice or foster care. And you see some of those listed there sort of in the roots of the tree. So violence, community violence, poor housing quality, and affordability or lack of affordability at all. All of this matters. And when we are addressing trauma, I think sort of in the direct service world and with service delivery, we're often looking at those branches and the leaves and trying to help where we can with those sort of front presenting issues. But we also want to consider what's happening underneath the surface, and that especially if you and your organization, as FPWA does, focusing on policy advocacy, that's where a lot of that comes in, is sort of those root systems. That's where the policy changes can happen. And that's where you can also start to interrupt the generational trauma so that one generation doesn't have to experience the same harm from systems that maybe their parents or grandparents did. And it's not easy, obviously. It's much more complicated than this one slide shows, but that's the idea that we're getting at here. Also, actually, before we move on from this slide, I just want to make sure that I say that we don't want to pathologize poverty and trauma either. Not, poverty doesn't intrinsically equal trauma. And for many people, they are experiencing that, but not everybody. So we really want to be looking at individuals when we're talking about trauma and what their experiences are and how they're moving through the world. And also this too, just keeping in mind that whenever folks are walking through our doors, and our doors meaning the nonprofit sector, the faith-based sector, that they may be experiencing some or all of these, a combination of things. No one is one single thing, right? It's a combination. And so that can be very complex as well. And so in order to set those people up for economic, social, mental health, well-being, and all of the things that we want, we really need to understand the roots of what they've experienced and are experiencing in order to properly address it. Like we say, we can't just put a little Band-Aid on it and send someone out the door and expect that everything is going to be fine. Okay, moving this forward here. Okay, so we're going to move into the next section. I know this is a lot, and it's going to take some time to digest. So just another reminder too for folks who may have joined late, we will be sending out these slides and also revisiting sort of all of these talking points throughout the fall and throughout our session. So this is not the one and only time that you'll be getting this information. But we're going to move on now to talk about the impact of trauma on a person's brain, body, and behavior. So again, it's really helping us understand why something is happening or why someone is saying something, so that we can learn as service providers how to deal with it more effectively, more calmly. Okay, so another polling question. You have a 50-50 chance here, so take a guess. So true or false? Individuals who have experienced toxic stress or trauma often, quote, act out for no reason. So let me launch that one and see what folks think. Okay, just give it another second or so. Okay, I'm going to end that poll. Thank you for everyone who voted. So we got a split here of true and false. And I suppose it's a bit of a trick question in some ways. It often seems like it's no reason or a big reaction came out of nowhere, or all of a sudden someone became very withdrawn. But actually, all behaviors and all reactions are coming from somewhere. It's not coming out of nowhere. And so the answer is false. So individuals who are experiencing toxic stress or trauma are not acting out for no reason, right? There's something behind it. And that's what we're trying to understand and really integrate into our thinking and our approach to this work. Okay, so with that, we're going to watch another bit of the video that we've been watching in pieces. And this one is the impact of trauma on the brain. So we'll start with the brain.
The problem with trauma is that it starts off with something that happens to us.
Sorry, I'm trying to get that little pop-up. I can see it on the screen. I don't know what that is. So give me 1 second. I'm going to stop sharing the screen, see if I can just make that go away. Okay. Let's do this. Sorry, folks, little technical difficulty. Just give me a second.
In the meantime, let me know if you want me to go ahead and share the video clip.
Sure. Can you still see that little pop-up that says welcome?
Yeah.
Him? Let me see if I can just start it and then stop it. Just move it out of the way. Okay. Is that better?
Yes.
What you can tell, Lilies? Okay. Thanks, everybody. Sorry about that. So let's try that video again.
The problem with trauma is that it starts off with something that happens to us, but that's not where it stops, because it changes your brain. Much of the imprint of trauma is in that very primitive survival part of your brain that I like to call the cockroach brain. There's a part of you that just picks up what's dangerous and what's safe. And when you're traumatized, that little part of your brain, which is usually very quiet, continues to just send messages. I'm in danger. I'm not safe. That event itself is over, but you continue to react to things as if you're in danger. We are talking about survival. We are talking about staying alive. And so some people go into fight flight, or on a more primitive level, people's brain shuts down and they collapse. You have these automatic responses that are not a product of your cognitive assessment, they're a product of your animal brain trying to stay alive in the face of something that that part of your brain interprets as a life threat.
Okay. So we're going to get a little bit more into what he was saying about what's happening to your brain and that fight, flight, or freeze response that the deep part of your brain launches when exposed to trauma. So starting here with a quote this is from Harvard University Center on the Developing Child. And they say that early experiences affect the development of brain architecture, which provides the foundation for all future learning, behavior, and health. Just as a weak foundation compromises the quality and strength of a house, adverse experiences early in life can impair brain architecture with negative effects lasting into adulthood. And so what that can look like is that sort of severe and long-lasting trauma that's unmitigated, or the positive protective factors aren't put into place. What can happen is that there's a negative impact on brain development in early childhood. We can see negative impact on cognitive development and learning, social and emotional development, attachment and trust with others. We see this a lot, especially getting into older years, is some trust challenges, as well as physical health and development. And what the image here is of the two brain scans. So the one on the left is a brain scan of a quote healthy brain, and the one on the right is a brain image of someone who has been experienced serious abuse and neglect. And you can see right away that different parts of the brain are lit up or not lit up. And we show this to show like what we mean by brain architecture. Something I want to be very careful about here and really want to let people know is that we are not saying that people with trauma histories are damaged, deficient, or broken. That's not what we're saying at all. We are saying that their brains may have developed or are processing things differently as a very normal trauma response. And understanding that may help you understand sort of why someone's behaving in the way that they are. So one example I want to give from in my previous work in taking cases is that for folks who've experienced trauma, for example, it can be difficult to tell a story in chronological order or tell it the same way again and again because of how the brain is processing that traumatic event. And so something I heard in a lot of casework was so-and-so is changing their story, they're lying, they're gaming the system, all of the sort of negative interpretations of someone's quote changing story. When in fact, that again, quote changing story is a very normal trauma response. And so when we talk about being trauma informed as a different approach, a different understanding, that's an example of what we're talking about. It's not assuming that someone's changing the story because they're trying to quote game the system, whatever that means, but rather that they're having a normal response to trauma and this is part of it and we want to react in a different way. I also hear that beeping and I don't know exactly what it is. I apologize, folks, for that. Okay. This image too shows I guess a graph. So the blue line is the brain's ability to change in response to different experiences. And the orange line is the amount of effort, so to speak, that such changes require. And you can see there from the beginning that in the younger years, it's quote easier to intervene, to give those positive protective factors. And as we get older, especially it looks like around age 29, 30 there, it kind of crosses and the amount of effort it takes is more than the brain's ability to change. But the point I want to drive home here is that it's never impossible. It's never too late. And so if you are working with older adults, and by older adults, I guess I really mean just 24 and older, right? I don't mean necessarily aging adults, but them included, that we don't just sort of give up and say it's not worth it. It certainly is. And you may need a different approach. You may need more time to build those relationships, but it can still happen. And just to, in case I haven't defined it, to say what positive protective factors are, those are caring adults, those are safe spaces, showing empathy to folks, anything that someone knows that they're cared about, they're seen, they're heard, they're safe physically, emotionally, socially, all of that plays into ameliorating some of those more negative impacts of trauma. Okay. So now we're going to go into moving from the brain to the body a little bit. So again, just as a review, the increased, when your body is experiencing toxic stress, or really any stress, but toxic stress and trauma for this conversation, what's happening to your body is that you're experiencing increased adrenaline, faster heartbeat, higher blood pressure, sleep disturbances, weakened immune systems. And that's all sort of quote normal. It's a normal bodily response to stressors. And what we see in a quote healthy nervous system is that you're starting from a resting position. And when something happens to cause stress, you move from resting to elevated. And so you're moving from resting to elevated, vacillating back and forth. But what's happening for someone who has experienced or is experiencing trauma, their body is sort of already hypervigilant and always at that elevated state as a starting point. So when the same stressor happens to them, for example, instead of going from resting to elevated, they're moving from elevated to flooded. And that's where you might see some of those outsized reactions that people say, well, it came out of nowhere, right? Like, I just asked if you finished your schoolwork from yesterday and you flipped over a chair, right? Like that was, out of line, or why are you, what's wrong with you? Why did you do that? When really nothing's wrong with that person. They may be experiencing something traumatic in their lives. They're already at that elevated state, and then something triggers them, so they go into that flooded fight, flight, or freeze response. And I also want to say that when we're talking about these, a lot of times, sort of the most obvious reaction are those big ones, whether it's cursing at someone, violence, slamming doors, things like that. But there's also the complete opposite, which is complete withdrawal, shutting down, and those are both sort of equal, opposite, but equal and normal reactions to trauma. Okay, so we're going to move on to talking about triggers now. And so when someone is triggered in their bodies, what then is the behavioral manifestation of that? And I'm going to pause for 1 second to see if I can make that beeping stop. So give me just a second, folks. Sorry. We'll go back to this. Okay. There we go. Okay. And you see that okay, Laura-Lise? Is it back? Okay. I stopped sharing this computer sound, so hopefully only I hear the beeping now. So let me know. Okay. Sorry, folks. So let's get back on track. So we're talking about now the impact of trauma on behavior. And so in that conversation, we're speaking about triggers. And so when something happens, what is the behavioral manifestation? So the first one that we often see is from sensory overload. So too many people talking at once, too many bright fluorescent lights, too much happening all at once can certainly trigger someone and cause a sort of, quote, outsized reaction. Also, another known trigger is touch, especially for those who may be experiencing any kind of physical or sexual abuse. Touch can certainly be triggering. And this is a good place to mention too, the difference between intention and impact. So for example, a lot of us will walk up behind someone, especially a kid who might be working on something at an after school program that you run, and just put your hand on their back. Your intention is to show that you're there and that you care about them, but the impact of that may be someone's behind me, someone has touched me, I don't know if it's safe, I'm going to turn around and hit them, right? I'm having that fight response. And then I get in trouble. I get sent out into the hall. I get suspended, right? The ball starts to roll from there. So being really aware of your intention versus what impact it may have on someone that's experienced trauma. The next one is being asked questions. And again, this is hard because we all do intakes, or we all have conversations, or there's plenty of reasons why we ask questions. But it also could be seen as sort of power, control, intrusive. So keep in mind, if you, for example, have had ACS visit your home the night before and ask a lot of questions, you may be sort of on alert for why someone's asking questions. And so it's really important to lay the groundwork for who you are, what you're going to be asking, why you're asking, so that it's not coming across as any kind of interrogation when you don't mean it to. And again, we'll go into a lot more detail about that in our next webinar. Laura-Lise, can you still hear the beeping? No, just me? Okay, that's fine. As long as it's just me, that's fine. Okay. So the next one I want to discuss is the punitive consequences. And this is a big one, both for nonprofits and, quite honestly, city agencies and government as well. This is where we want to get into the systemic change here. So punitive consequences could be for real young kids, time out, go out in the hall. As you get older, it could be you're suspended, you're kicked out of a program. As you even get older, it's more seclusion, restraint, arrest, incarceration. All of those things are real punitive consequences and can certainly be triggering, traumatizing, re-traumatizing, harmful. And so when we're talking about a trauma-informed approach, we really want to move away from punitive consequences, away from harming, and into healing. And again, we'll talk more about that. Another one is change in schedule and plans. So part of going back to that very first sort of definition of trauma where we feel hopeless and helpless, lack of control, lack of knowing what's going to happen next can be very traumatic. So taking into consideration those folks who don't know where they're going to sleep at night, don't know where their next meal is coming, don't know if the person who's supposed to keep them safe is going to do that, or if that person's going to harm them, not knowing if you're going to come home from school and you're find out that your parent has been deported, right? There's all kinds of things in that realm of the unknown that can be incredibly traumatizing. And so we want to keep that in mind, that when we change schedules or plans or routines without letting someone know, that can be triggering and then trigger that sort of outsized trauma response. And so being as clear as you can and as sort of early on as you can about what's going on is really important. Another one is loss of supportive relationships. And this was especially prevalent during COVID and still. But whether we're losing folks because of a death, people passing away, or when school, for example, shut down and everybody went remote, all of those young people lost their supportive relationships of friends, coaches, teachers. People lost colleagues. It was cut off immediately. And those loss of support relationships happen obviously outside of COVID too. Someone is arrested and therefore gone all of a sudden. That could be a loss of a supportive relationship. So we really want to be sure to keep that in mind of what's going on in someone's life and why they may be triggered. And the final example of triggers and how it relates to behavior is isolation. And isolation certainly could be physical isolation, right? You're sent out into the hall by yourself, you're kicked out of a program, you're kicked out of your home, you are, you're detained for whatever reason, but can also be sort of social and emotional isolation. So you're falling behind and you just can't catch up and you feel left out. Something we saw a lot during COVID was you don't have access to technology. And so you're getting further and further behind in your classes or your after school program or whatever it is that you're doing. And you're feeling isolated and alone. You can also feel isolated if the people around you have unreasonable expectations of you and they're not supporting you in meeting those expectations. That can be isolating and therefore triggering, and you may have an outsized reaction or extreme withdrawal. So all of that to say that trauma certainly has behavioral manifestations, and that when folks are acting in challenging ways, it's not because of sort of those negative stereotypes of they're just attention seeking or they're a quote bad apple, right? Like we want to move away from those. I don't even like to say them out loud because what we want to do is understand what's going on and that it's a very normal, quote, normal behavior in terms of a trauma response, and how do we approach that? Okay, so something that I want to point out, and we've certainly hinted at this, but we want to be explicit about it, is when we're talking about both nonprofits, faith-based institutions, and systems, is keeping in mind, are we helping or harming? And certainly by trying to use a trauma-informed approach, we are moving toward helping. But wanted to share this quote again from SAMHSA, and this is from their concept of trauma and guidance for a trauma-informed approach. This is a little long, so I'll read it slowly. Public institutions and service systems that are intended to provide services and supports to individuals are often themselves trauma-inducing. The use of coercive practices such as seclusion and restraints in the behavioral health system, the abrupt removal of a child from an abusing family in the child welfare system, the use of invasive procedures in the medical system, the harsh disciplinary practices in educational schools or school systems, or intimidating practices in the criminal justice system can be re-traumatizing for individuals who already enter these systems with significant histories of trauma. These program or system practices and policies often interfere with achieving the desired outcomes in these systems. So if I had to sum that up, it goes back to what we were saying in the previous slide or two about intention versus impact, and really thinking about what are our practices, our procedures, our rules, our reactions. And even if it's all with good intention, right? We want to keep things orderly, we want to keep things safe, we want to make sure everyone is held to the same standard. What is the impact of that? And how can you still have those expectations, right? We do need to keep people safe. We do need to have rules, absolutely. but how can we do it in a way that is trauma informed and therefore helping as opposed to reharming, re-traumatizing? Okay. So as I said, this last portion is a bit more of a teaser, an introduction, a trailer, if you will, for the next session, but I did want to be able to touch on it at least momentarily, because I don't want to just leave you with heavy information and the feeling that there's not much you can do about it, because there certainly is, and that's the whole point. So we're going to move in for the next just couple of minutes into the importance of trauma-informed approach within human services organizations. Okay, so first we have our, excuse me, a last poll, and that is, what is trauma-informed approach? Is it a clinical therapy to support people with PTSD, anxiety, or other symptoms related to trauma? Is it a method for diagnosing trauma amongst your program participants? Or is it C, an approach intended to help individuals feel safe, welcome, and supported? So let me go ahead and launch this last poll and let you vote on A, B, or C for what is a trauma-informed approach. Okay. Oops, sorry. So the answer there, oh, nope, go backwards. The answer there is C. It's an approach intended to help individuals feel safe, welcome, and supported. I can share the results. I guess I didn't do that. Okay. Let's move us forward. Close that. All right, so we'll talk briefly about what we mean. So first, let's talk about trauma therapy, just to make sure we understand what it is and why that's not what we're talking about in whole here and moving forward. So trauma therapy is an incredibly important piece of the puzzle, but it should absolutely be done by a licensed clinical mental health professional. It's an intervention that occurs in the therapist or counselor's office, usually one-on-one or small group sessions. And the focus is really on treating the symptoms of trauma, so depression, anxiety, PTSD, et cetera. We are not advocating that anyone that is not a mental health professional at your organizations is screening for trauma or trying to, quote, play therapist. That obviously can be dangerous, and there is a place for it, and we want you to have a system of referrals for that. But we're instead talking about trauma responsiveness or trauma-informed approach, and that is very intentional. And that is because a trauma-informed approach involves thinking and responding differently to a person's reactions and behaviors. It's about considering what happened to you rather than what is wrong with you. It focuses on moving away from punitive consequences and toward next steps that aim to build healthy coping skills and promote healing. And best of all, they are practices that can be used by anyone in any setting. You do not need to be a mental health professional. And we'll talk again on the 29th in more detail about what can you say, what can you do, but we really say that most of them are free. They can be used by anyone. So these types of trainings are important for your entire staff at your organization, not just the social workers or the counselors or the executive directors, literally for everybody. Okay. The last definition here to leave you with, that a trauma-informed or trauma-responsive organization is a program, organization, or system that realizes the widespread impact of trauma, and that's what we're trying to do today, understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and actively seeks to resist re-traumatization. Okay, so how do we do that? In our last couple of minutes here, the things we want to leave you with are that trauma-informed strategies generally fall into two categories. First being creating a safe and supportive environment, and the second is fostering trusting and meaningful relationships. And why is that? When we're creating a safe and supportive environment, that really helps to address the flooded nervous system that we talked about, right? Moving from elevated to flooded, the hypervigilance, and or feelings of helplessness and hopelessness that are often associated with trauma. For relationships, the reason why that is so important is that because those who have experienced trauma are often feeling isolated. They may feel ashamed, alone. They may blame themselves for whatever it was that happened, right? If I just acted better, I wouldn't get hit, right? And we know that's incorrect, but it's often a trauma response. And so really fostering trusting and meaningful relationships can address those feelings of isolation, blame, distrust, and shame. And Miley, the two key takeaways that we want to say when we're talking about trauma-informed approach is that being trauma-informed and trauma-responsive is primarily a shift in mind frame and approach. It's not a new program. It's not a new initiative. We don't want anyone leaving here today being like, I'm too busy to do this. I can't take on a new thing. It's really integrating into what you already do. Also, most of the strategies are free of cost and can be effectively implemented by everyone at your organization. So from front desk to, if you're, an after school teacher, if you're a counselor, all folks can do this and can do it effectively and make a real difference in the lives of the clients, families, program participants. So with that, I'm going to leave you with one final plug. Again, I know we've alluded to this, but in two weeks, I believe, September 29th, we encourage you to come back for our next foundational webinar, which is trauma-informed service delivery. So we sort of know what trauma is, we know the definition, we know the prevalence of it, we know what's going on in a person's brain, body, and behavior. And so the next step is to really focus on what's next. What do I do now? And so we'll break this all down for you into specific strategies about being trauma-informed and provide suggestions for what you can do, what you can say. So please do join us with that at that webinar. That one will also come with a written resource, a 2-page resource, that's sort of a matrix of strategies that you can take and use. And so the registration link will be sent in our follow-up email. It's also available on our website. And I'll wrap it up there. I know we only have a couple of minutes, but I'll ask Laura-Lise if there was questions that sort of came up multiple times that we should address out loud before we close out for today.
So I started answering some of the, sorry, let me just show my face. So I started answering some of the questions already in the Q&A. We did have a follow-up question that I said we would get to in the follow-up email around the brain and how the brain responds to healing from trauma. So we will be sending out a more detailed response to that one in our follow-up email. But if you want to add anything to that. And then just a reminder, on the 29th, we will be hosting our next session. And like Audia said, that will have an accompanying written material that you can have at your desk at any moment. It is open to anyone in any level. And it's we break it down really easily for you, like what you can do and what you can say to be more trauma informed. And so just a plug for that one.
Perfect. Thank you so much. And yes, we'll in our follow-up email with the PowerPoint slides, we'll send out link to the videos we were showing, as well as a link to some of the websites we use for those quotes and images, Harvard and SAMHSA and some of those, so you can take a look at that as well. So thank you so much for joining, for sticking with it, for dealing with the beeping. I promise I'll figure out how to make that go away before the next session. Thanks for sticking it out with us. And we sincerely hope to see you in 2 weeks for our next session. Take care. Bye.